Hello, everyone. Papa Gary here, and today I've got a unique opportunity, and I'm very happy for this because I'm going to have you meet my doctor. This is my primary care doctor. His full name is Charles Wesley Clements II, right?
Third, actually. I'm number
Third,
three.
the
Yes. Yeah.
third. And so a lot of musicians here, especially those who play in the churches, will know who Charles Wesley is. And, were you
I've heard
named
the name. I
after?
don't think I'm actually named after the Charles Wesley, but
Okay.
this maybe not. I could be. We actually don't know.
That's all right. So, but that people will associate that name. So,
Sure.
and you
Yeah,
go by Wes, I think,
that's right.
in your practice. So,
That's right.
and I originally met you in another practice in a clinic, and
That's right. Kind of the
before,
traditional primary.
right before you started your own direct primary care practice, and then I transferred over with you, and that's been, gosh,
5 years ago.
yeah, 5 years ago. So you know me pretty well.
That's right.
And
Yeah.
I've talked about my hand issues, especially with arthritis, and
Mhm.
then stiffening up at the hands and trying to play and me being concerned about that. And also, how I could use the piano as physical therapy and practicing technique. For instance, if I'm just playing arpeggios or chord, it's in how the hand flows in the motion instead of a stiff, which causes a lot of tension. So let the hand move so you don't have to really, you know, stress or grab at the keyboard. And then a lot of students really don't know how to develop this yet. And
Mhm.
especially older adults coming back to the piano, or they're studying again and they feel awkward about what they're doing, or they might be concerned about their arthritis issues or whatever issues you're having. So we did discuss the arthritis that I have in my thumbs a while
Mhm.
back, as you recall that. So, and we just said, keep practicing, right? And then
Right.
see if you can loosen that up and um, and continue what I'm doing. And it actually, I was using those creams, if you recall, you know,
Diclofenac or Voltaren gel.
yeah,
Things
yeah.
like
And I was using those creams for a while, but once I started to loosen up a little bit more with the knowledge of what I had at technique, it started, loosening up in everything I do in life.
that.
So it's still with me,
Mm-hmm.
but, I'm able to overcome it, especially if I'm playing big octaves, where I have to stretch like that. And it's the approach, how I come at it. See? And then once I do that, I'm not forcing anything.
I
So,
think it's amazing because there's not really great options for hand or finger arthritis.
mhm.
And so the fact that you found something that works and is pretty remarkable.
Well, thank you. I mean, you helped me with that, obviously.
Yeah, yeah. Like
So,
well, I think it's due to you kind of keeping your hands active
yeah.
with, you know.
So, would you say that piano playing or learning to play the piano with a correct kind of flowing technique would be a physical therapy?
I do. I do think so. I think
Okay.
it's the most fundamental um principles of physical therapy and that it's strengthening the muscles around the affected joints, which
Hmm.
protects the joint. So,
Really?
when somebody has, let's say, knee osteoarthritis, it's degeneration or degradation of it's wear and tear of the
Hmm.
knee, the bones. That's when they say bone on bone. It's wear and tear down to the bone.
Right.
And no physical therapist tells you to stop using your knee.
Right.
They tell you to use it more, strengthen the muscles because the muscles then create the stability rather than the soft tissue that was previously
Uh-huh.
there. And
Okay.
it takes time and effort to do that therapy, but eventually it can create a lot of relief in that joint.
Hmm.
And I would say the same thing goes for all joints, including the small joints in the fingers and the hand, and that doing something with dexterity, range of motion, and strengthening around that joint is physical therapy for sure. And piano seems like naturally just an amazing way to check all those boxes of physical therapy for the fingers and the hand.
Right. Now, when somebody's taking piano lessons, they start off, I'm going to take piano lessons just because I'm having hand pain. That's going to be my physical therapy. So,
I think
I,
that's a little risky,
okay,
because the instructor might not have they might not be thinking along the lines of the correct posture and everything. Maybe they are, but I think there's a chance that that's not the case,
hmm
and that may do more harm than good. Um,
yeah,
that's what I would
you
say
know,
to that.
for instance, a lot of people go online and they buy these apps, or they will go
Ooh.
to a music store down the street and they'll have a college student that might not understand where this is at. And then also, a lot of pianists also develop carpal tunnel.
Hmm.
And is there a way to do that? I think there is, from what I've done, because years ago when I was in my 30s, I had it. And by the way I practiced,
Hmm.
helped that go away. So I wasn't aggravating it. So is
Right.
that also kind of like a physical therapy, you think, if there's carpal tunnel?
For sure. For
Hmm.
sure.
Right.
Yeah, I think I we tend to think that overuse causes carpal tunnel. And while there's a grain of truth to that, I would say misuse is a better description of the cause of carpal tunnel, or poor position.
Hmm.
And I noticed that when you're holding it there, so this flexion, a lot of flexion causes carpal tunnel. A lot of tension in the hands will cause carpal tunnel.
Hmm.
I noticed you had a very neutral wrist when you showed that
Yeah.
example. And that I imagine would be very relieving of carpal tunnel and not exacerbate or worsen a carpal tunnel syndrome uh,
Right.
as much.
So I don't know if you've seen any of my class that I teach on this at all, but I had a student, David, and a couple other students that had carpal tunnel. He's a computer programmer, and so he's doing this all the time. And he was having issues, but I was teaching his daughters, and he said he wanted to take lessons. And so I actually have a video of him on my YouTube and that. So, but I taught him to get out of the keys and lift his hands
Uh-huh.
as he's playing. And he said his pain's gone away, even at his work.
Wow.
So,
Very good.
yeah, so that wouldn't be, to your mind, that's not just a coincidence.
No, I don't think so. No.
Okay.
I
Yeah.
think what you're doing is therapy here. I think
Oh,
and your personal examples are a true testament to that.
yeah.
I mean, I can't think of many people who've had more unrelated hand pathology and then improved it with the piano. The
Right.
piano not being the cause, but the treatment.
Right. So, I mean, on January 31st of this year, I fell and I dislocated my thumb in my left hand and my middle finger in my right hand. And I'm
Hmm.
not sure, there is a leaf blower outside my front window right now. If you can hear it, that's what that is. But anyhow, that's an aside. So when I fell, I was walking my dog and I dislocated there, ended up in the emergency room. And the doctor actually told me there, after he reset everything, they took x-rays and it said, your middle finger is never going to be the same. And I said, well, I'm pianist and classical organist. And he's like, you're going to have surgery. And I'm like, I'm not going to have surgery, because wouldn't surgery, that's risky. Is it not about cutting into the nerves and feeling what you're doing? Would you say?
Yeah, there's some risk with surgery. So if somebody can improve it without surgery and get the function, I mean, it's all about function and pain. Those are the two big categories. If somebody has two reasons to get surgery, would be extremely high pain that's debilitating to being able to use the hand, or just the range of motion or the strength making somebody unable to use the hand. So those are the two things that somebody should get surgery. So if somebody can fix that without surgery, definitely better to go
Okay.
surgical.
And as you recall, I came in to you a few days later, you know, because you're so flexible with your appointment schedule. I love
Ah,
it.
yes. Same or
Yeah,
next day, everybody.
that's right. That's right. We're going to get into that, but still, um, you know, I for the day after, I'm back up here. The day after I fell, I had these metal braces on, and I actually have videos of them on my YouTube. But I took them off and I started playing simple things, and I applied an exaggerated motion
Mhm.
to it. So when I did that, I found I was able to play lightly and not feel the pain.
Mhm.
And I wanted to continue practicing my pieces that way. And I came into you and, you saw the splints and I showed you the shape of the finger that I needed to have. And you actually made me a splint.
Yeah, little homemade splint.
Yeah, you used whatever kind of tongue depressor
Mm-hmm.
sticks and tape, and I wore that for about what 3 or 4 weeks,
Yeah.
and and that really, you know, helped me from even when I'm doing other tasks, grasping or bending my fingers in a hurry, and trying to do all those things, but I could still practice, and that was really something very helpful, and it
Mhm.
got me through that period. Now, today, it's what August the 27th, and I am still feeling the pain at times, not all the time. It still feels stiff. And you remember when I was in your office just what, a week ago, I had you feel the joint.
Yeah, the medical term for what I felt was called crepitus, which is a crackling kind
Yeah,
of, yeah, it's
yeah.
Rice
It
Krispies in there.
it crackles, but
Uh-huh.
I only feel it if I touch it and do that. So,
Good.
but my finger feels stiff always.
Mhm.
That doesn't go away. But, I'm finding that I can still play, with that hand.
Wow.
It's in the motion of how I do it rather than just pushing real hard into the keys. And so I
Mhm.
really appreciate you being sympathetic about that and understanding. But I don't think many people know these things, that piano actually is a good way with the right teacher that they can overcome the pain at the piano.
Yeah, I
Yeah.
think that is a good way.
Yeah. And so whether that's arthritis or carpal tunnel, um, I don't know so much about other issues you might, but things like dystonia or anything like that. Um,
Hmm.
I don't know. I'm not that much of an expert in
Yeah, I think
in that.
arthritis is a big one that comes to mind, and so many people have hand arthritis with very few options.
Hmm.
And like you said, we try the topicals, occasionally ibuprofen, Aleve, Advil, Tylenol, those kinds of things. But there's not too much to do for hand arthritis because it usually affects multiple joints too. And so you're not going to do like injections in all your fingers or things like
Right.
procedural stuff for hand arthritis. So I think the best is therapy. And like I said before, I think piano just to me meets all the criteria because you're um it's it's got it's just using them all individually
Hmm.
and strengthening all those small muscles, those fine muscles,
Hmm.
and
Yeah.
make and gamifying it, right? And nobody wants to go to physical therapy. I mean, it's very good. I mean, I probably refer to physical therapy more than any other specialty. I believe in physical therapy, but nobody really likes to spend 3 days a week doing physical therapy, going out to to a physical therapist and talk. And they need it, but
Hmm.
it gets kind of boring after a while, and we lose focus. And so I think by gamifying it and
Yeah.
making it in, getting it out of an instrument, it's just like two
Yeah.
two for one kind of deal.
Right. But a lot of times people don't want to practice.
Yeah, that's true. That
You
happens
know,
too. So I guess you
and
see it in all
so
aspects.
you got to make the practice interesting.
That's
Short
right.
sessions. Do you think short sessions would be helpful?
Yeah, for sure.
Yeah. So instead of thinking I've got to practice 2 hours, I do it now in 30-minute sessions. Some of
Yeah,
my students do it in 20-minute sessions, and they do it several times a day,
yeah,
and that seems to help them. And so what we're saying is it's the same thing, basically,
right.
if applied correctly.
Yeah, I think so. If done with somebody who understands proper hand mechanics and finger
Mhm.
mechanics on the piano, I think I think it is a therapy.
Yeah. Well, I appreciate that. So maybe you can just send students my way when they need the physical therapy. They can learn piano. So,
Right.
yeah.
Yeah, exactly. Like a two for one. I think
And
so.
they can do it right like we're doing it now from the comfort of the home. So,
Mhm.
and
Yeah.
then have the lessons that I give them. But I think that's pretty much everything that we need to talk about as
Yeah.
far as what the hands can do and what good playing does. Okay?
Yeah.
Now, for everyone here, I want to also say that Dr. Clements here went to Marshall University for the med school. That's also my undergraduate, where I got my Bachelor of Music Education degree. And so one of the reasons when I found Dr. Clements was that I saw that when I needed another doctor and said, okay, good doctor.
Good school.
Good school, good doctor. And so that's how we first met each other. So
Yeah.
you're now doing, let's talk about what you're doing now. Um, you're doing a practice called direct primary care. And I had no idea what that was when I first came to it, but I love it now. Now I
Oh,
pay
thank you.
a monthly fee. Heck, I even bring my dog to the office
That's right. We
when
look
I
forward.
come to you, and he
Yeah.
just sits there and we just have a chat and all that. But it's
We enjoy Winston's company.
yeah, yeah, he's a great dog. He's sleeping here right now. But it's so easy because I can contact you at any time, basically text message, whether somebody's responding to me right away, prescription needs refilling right away, and it's just, a small monthly fee.
Yep. That
And
you summed it up. Yeah, direct primary care is about finding efficiency and a higher quality experience by cutting out the insurance middlemen, which really bogs things down, and it lets us do exactly what you said, longer visits, hour-long visits, same or next day guaranteed, and we just text directly with our patients.
mhm,
So it's kind of what people want but can't get through the insurance model.
right,
Um,
yeah. And yeah, and so that was very hard for years. And so when this model came up, it's perfect for me.
yeah.
So, and then especially what I was doing, because I can imagine the insurance process having to take me through hand specialists saying, okay, you're going to need surgery, you're going to need this,
Mhm.
and just getting all this information that's just, not helpful.
Yeah.
And so, but also I noticed your lab costs are a lot less.
Oh yeah. Now, most of our patients have or use insurance, but the funny thing is that our labs are definitely for people without insurance. It's a great deal, but also even people with insurance, because deductibles are so high nowadays, they often take advantage of our negotiated lab prices. And we're kind of a DPC is more than just a niche. It's kind of a movement to change healthcare, and the only way to do that is you can't ask people to spend their hard-earned money just because they believe in the movement. You got to offer a better service for a better price, and we believe that in the whole healthcare ecosystem. So the way we're going to change healthcare is is really just provide better full scope healthcare at a better price.
Yeah.
And one common aspect of healthcare is labs, and so we've negotiated labs that are $5 each for
Yeah. For a
90% of
full
that.
panel,
Yeah, yeah.
yeah, and that was
Um,
amazing. And so, I've saved so much more, so much more money by going this route
mhm.
than paying all those deductibles and getting into all that. So,
Yeah, I would say half of our patients who use our cash pay labs have
yeah.
insurance, you know? So it's not a safe assumption. With the way insurance has become with such high deductibles, it's not a safe bet to assume that your insurance is going to cover something and
Hmm.
then cover it at a reasonable price. Those
Right.
are two assumptions that often fail.
Yeah. Yeah.
Uh,
So, but the name of your practice is Tailored
Tailored
MD.
MD.
Yeah. And if you're in San Antonio, look them up. And so,
Thank you.
and I deal with people from around the country and I'm even in other parts of the world who have talked to me here. And so, is there a way they can find that model in their areas?
Yeah, so they could go to now in the this is United States. It's called DPC Frontier.
Okay.
dpcfrontier.com. And there's a map that locates all clinics like us throughout the United States. And there's actually over, I think there's well over 2 or 3,000 now.
Mm.
It's going to be the majority in the next 10 years.
Yeah. Yeah, I think so too. And so it's really, I remember as a kid getting home visits from my doctor in
Mhm.
Huntington. And so he had to come over just to check for the common cold and things. So it's kind of similar to that. I think you even do home visits for a
I
little
do
extra.
sometimes. I
Yeah.
don't on a regular basis, but I do sometimes if there's somebody who's uh, has a primary care need and they're confined to the home, they might consider kind of doing home
Yeah.
care with us.
Yeah.
But we find that need isn't very much now because of all the technology. which the traditional healthcare is afraid to do because it doesn't reimburse well by insurance.
Right.
Um, so, texting, calling, Zoom calls, just like this, I have
Hmm.
with my patients, and a lot of times that takes care of it.
Yeah. And I'm finding that ever since COVID in the 2020, I'm finding that's true for piano teaching as well.
Yeah.
I can relate to the student. They can text me at any time. They can do all this, but then, I can send them a video and say, try this or try this, and they can't do that with one-on-one lessons.
Hmm.
And so then I can observe their hands actually better
Yeah.
by doing this model because I'm not doing it right here right now, but I have closer views on my hands and on
Hmm.
the keys and different cameras around. But it's a really good model, and I think the technology is really helping both of our businesses here. So,
I think so.
okay. So now, for somebody that's wanting, to have their hands reviewed, for instance, and they're in a direct primary care situation, they can come to someone like you and discuss what that, and then make the smart decisions, choices, get the options, should I go to a hand specialist? Should I do whatever, get surgery, whatever, and then do a plan of action and see how it goes. And that's the beauty of this, model here and why
Mhm.
it's helped me.
Yeah.
And heck, you even made me a hand splint.
Yeah.
And
Little
yeah,
MacGyver action there on that one, but
that's right. That's right.
yeah.
But it was so helpful. And, I even have YouTube videos up on my channel right now where I was playing with that. So people
Nice.
can see, this is not just a story. So
Yeah.
anyhow, but I think, getting people to realize the benefits of what we do and
Yeah.
how it can help is great. So
Yeah. I really think that what you're doing for people with hand pain and arthritis, I know that you work with pianists who have that issue, but I also think people who just have those problems, hand pain, arthritis, should consider a hobby or whatever you want to call it, should consider
basic lessons, yeah,
what you offer as a therapy.
yeah, and they can start to learn and enjoy and do it from their home. So
Exactly.
so this has been great. So I know you're a busy guy. I appreciate your time,
I
and
appreciate yours.
I like that Marshall University degree up there in the background,
That's right, right
and
there.
the Marshall
Go
green,
herd.
the green on the bookcases.
That's
So
right.
yeah.
Yeah.
So
You saw it.
right, is there anything
You're
else
good.
you want to say about how people can contact you?
No, tailoredmd.com is probably the best way, and then you can learn about us and select through there. And yeah, I appreciate you having me on here, and I love talking about your story and hope that more people see this as an option for treatment of their hand issues.
Yeah,
So
I
thank
think
you.
it's a good way. So thank you for doing that. I appreciate it. Not many doctors would do this. So
Yeah. Well, we get time to think outside the box. That's the beauty of it. And
there you go.
yours is outside the box thinking in a very good way,
Yeah,
what you did and what you offer.
thank you. So we're going to keep pushing forward and we'll see you next time. Maybe we'll have some more questions. We'll let you know.
Sounds good. Call me up anytime.
All right. I thank you.
Thank you.
I